My name is Mike, I'm 67 years old and I've been volunteering for a year. I've had quite a few health problems and the NHS has always been very good to me. Both our children were born here at the hospital and my wife trained as a nurse here and she was working here for 25 years. The main role is pharmacy runner. That involves taking medication from the dispensary up to the wards for the patients who are being discharged. And because I can collect the prescriptions as soon as they're ready, it means they don't have to wait for hours before they go home. So the patients are happy, the staff are happy, and I get to walk about 5 miles a day up and down the stairs, so I'm happy too. The hospital has a mailing list of volunteers, so if they need extra help, then they let us know to see who's available. So other jobs I've done include taking cold drinks round to the elderly patients in the summer, and making sure they have enough to drink. And also when the coronavirus appeared, going out into the community, driving out to collect breathing equipment that wasn't needed in homes and delivering face masks to GP surgeries. I work a Monday. It was my choice and I chose Monday because that suited me best, and they like you to commit to 2 hours a week, but I do 5 hours on a Monday, 10 till 3. Well, I like the exercise. As I said, I get about 5 miles of walking up and down the stairs, so it helps to keep me fit. I think it's probably a higher risk for the permanent staff who are possibly in constant contact with the virus, but I'm walking the corridors, I'm going into the wards, but I wear a face mask, I wash my hands a million times a day. In between the pharmacy running, if there aren't any prescriptions to take, then I'll go into the pharmacy stores, and that's where all the medication comes in. And it has to be scanned into a robot which stacks the shelves. So that's another job that I do. And if they haven't got anything for me there, often the volunteer manager has deliveries to take up to the wards, such as goodies for the staff. We get a lot of donations from local companies of sweets and hand wash and shampoo and toothpaste and that sort of thing. And I take those up to the wards for the nurses and the staff. Their faces light up when those trolleys arrive. Are those for us? I took some patient wash bags up to a ward last week and the ward clerk said, I only asked for these 5 minutes ago. And it's nice to be able to give them that sort of response time. I enjoy it very much. It's nice to do something useful for the hospital. It's nice to see the appreciation of the ward staff when I deliver what they're waiting for. And I love the exercise.
My name's Ken Mitchell. I've been involved now with the hospital since last year. I've been under the hospital myself for the last 8 years and with various operations. I felt that this is one way of paying something back. I did not find that the COVID-19 worried me in that sense when I volunteered. I do 2 days a week from roughly 10:30, 11 o'clock in the morning up until 4 o'clock and sometimes a bit beyond. I enjoy it. They're a great team to work with. I find that they appreciate you coming round because obviously patients would like to go home, and the idea of a runner is a bit of a backup for the general porters, and they appreciate it. Sometimes they're more shocked because obviously we've got round that quick. I find it's a worthwhile thing doing it because you're not only doing it for the patients, you're doing it for the staff. They have a busy enough job in and out around the hospital, especially ones that are in more isolation. So they do appreciate it, and I feel as if I'm part of that team. Sometimes I wish I could do more.
So my name's Kirsty and I am the Deputy Manager of the Dispensary and Pharmacy. Our pharmacy runners have obviously been a huge help during the COVID-19 pandemic. By having them take the prescriptions up to the wards, it means that the patients aren't waiting as long to go home. It's freeing up the capacity in the hospital. So straight away after they started, we could see the positive impact by looking at our collection times. They've helped decrease it by around 50%, so it means that these patients aren't waiting as long to go home. Our pharmacy runners are also a big help in the dispensary dispensary, so they help with housekeeping duties, and they also support pharmacy stores with putting stock away. We're very grateful for the help and the support that we get from our volunteers. They're very much a part of our team, and we all want to say a huge thank you.